Okay.
Hello, doctor. I've noticed that my gums are bleeding while I'm flossing. Could you please let me know if this indicates a less severe or more severe form of gum disease, or if there could be another reason for the bleeding?
So, gum disease, the earliest sign of the gum disease is the bleeding. So I can tell you just based on the bleeding that you are talking about, whether you have early gum disease or you have the most severe form of gum disease. So um, you got gum disease. And the only way to tell that would be to when you come in to the office and we do a variety of exam, we do a clinical exam, and then we also take a CBCT or like a CT scan, and we should be able to tell you what type of gum disease that you have. And to answer your second part of the question, can the gum bleeding could be to a different reason? Yes, absolutely yes. And it could be sometime when patients take blood thinners and it makes your blood kind of thin. So even though you may not have gum disease, it may have a tendency to bleed, or you may have early signs of gum disease, but it is going to make it severely bleed. And the other thing that normally happens on women is what?
Um,
Pregnancy,
Pregnancy.
right?
Oh,
Yeah,
yes.
pregnancy. So,
Yeah.
and that happens, and when the women get pregnant, they may or may not have any type of gum disease because of the hormonal changes that happens, and the gums start to bleed. And also, it's not uncommon during the periods or the menstrual cycle. Women have a tendency to bleed more from the gums. So these are all the common things. Again, talk to the dentist and see whether you have gum disease or not. So if you happen to have blood thinners or pregnancy or menstrual cycle and you're bleeding, that's okay. But you don't want to ignore when you have bleeding, when you're bleeding all the time.
Very true.